Well, New York State has become the first in the nation to require all healthcare workers to get a COVID-19 vaccine or face being fired. Before last night's midnight deadline, there was a dash for vaccinations. Of the 450,000 hospital, nursing home staff, and other healthcare workers, the governor's office said today more than 90% have gotten at least one shot. But as John Yang reports, many hospitals are bracing for staff shortages if they have to lay off workers or some leave the profession altogether.
While New York Governor Kathy Hochul says the vaccine requirement is needed to try to curb the spread of COVID, she acknowledges the problems it may create for hospitals already strained by a surge of cases caused by the Delta variant. She's declared a disaster emergency, opening the door for healthcare workers from out of state and even out of country to practice in New York.
It reflects my priority to just stop this virus dead in its tracks. We are over it. We are done. We want to move on. And the only way we can do that is to ensure that everyone is vaccinated, but particularly individuals who are taking care of the people who are sick.
To see the effect on one healthcare operation in New York, we're joined by Tom Quattrochi. He's president and CEO of the Erie County Medical Center, which operates a hospital and a nursing home in Buffalo, New York. Mr. Quattrochi, thank you very much for joining us. What's been the compliance with your staff so far on this vaccine requirement?
Well, thank you, John, for having me. We're down to about 5% in the hospital of folks that had to go on unpaid leave as a result of the vaccine mandate. In our nursing home, it's a little different situation. About 20% of our workforce is on unpaid leave. And that's kind of a common theme among nursing homes because some of the workers are lower on the wage scale. They're able to make other choices and get out of healthcare if they choose to be unvaccinated. So for us, it's a challenge because obviously patients need to be discharged from the hospital to nursing homes. So it's kind of clogged up a lot of hospitals with patients who really belong in nursing homes but are stuck in hospitals.
And what are those numbers doing to your operations in terms of elective surgery and that sort of thing?
So about a week ago, we started seeing this effect that I discussed about nursing homes kind of not accepting our patients. So we had the highest census we ever had in history with 56 people waiting in the ER. So we took some mitigating steps. We stopped inpatient elective surgeries. We stopped many of our outpatient visits. We stopped medical ICU transfers from rural hospitals and other lower levels of care. So we took some mitigating steps. It did have an effect on lowering the volume. Right now, we have a lot of people that remain taking extra shifts for us, and we incentivize them to do that, and that's working very, very well. But this is a longer term problem. In the short run, we're managing the situation, but we're very concerned long term because we had some of these staffing issues prior to the decision to do a vaccine mandate.
And you say, at least in the hospital, a lot of the unvaccinated workers are so far being put on unpaid leave. You're not severing them altogether from employment. Are you hopeful that they'll come around, that they will eventually become vaccinated, or what's the situation?
Yeah, we weren't certain what the actions of the state would be around the date, so we wanted a little bit of flexibility with those workers. They do have 30 days before their employment will be terminated, and there's some question around exemptions and religious exemptions and those types of things. For us as a public institution, it's very hard to sever somebody from employment and then bring them back. So we have a unique challenge in that regard. That's why we decided to do the unpaid leave.
Are you talking to them at all?
We are. Many people actually, as a result of the incentive to work extra shifts, which is obviously extra money, some of them came back and received vaccinations because of that. So, you never know what's going to work in getting somebody motivated to be vaccinated. But, as we continue to educate, and I hope colleagues continue to talk to them about the importance of vaccination, we'll get some folks back. But the reality is there are some people that just believe in either choice or they don't want to be vaccinated for whatever reason, and they're leaving healthcare.
And you said there's a difference between the hospital workers and the nursing home workers. The nursing home workers, you say, tend to be lower on the pay scale. Is that right? And so more likely to go elsewhere?
Yeah, the way the reimbursement models work for nursing homes is it really doesn't support as much nursing care as it maybe probably should. We actually have a higher nursing ratio than many other nursing homes, but it's supported by a lot of aides. And those aides are, in the range of anywhere from about $18 to $20, somewhere around there. And as you know, many organizations are offering that kind of wage for workers, including fast food restaurants. So they can't get the benefits maybe that they would have at a place like ours, but they can get the same wage.
If the governor had not placed this mandate or placed this requirement on healthcare workers, had you been considering doing it on your own?
We hadn't. We had not considered that. We were, continuing to educate our staff, and we were also worried about the fact if we did it, then those workers could go to another hospital somewhere else. So it was a competitive issue for us. So the government's doing the right thing for all the right reasons. There's just a reaction and effect that it has on the healthcare industry. So we're trying to work with the state government, and we're supportive of the vaccine mandate, but we just need some help with the reality on the ground.
And as we said, the governor's opened the door to not only out-of-state but out-of-country healthcare workers. Is that something you think you might avail yourself of?
We'll have to see if that can be helpful. We're just grateful that the governor's trying everything that she can do in her power to help us. It's a challenge. Agencies across the United States are charging crazy amounts of money for agency nurses. Talking $150 to $200 an hour. Normally, it's about $65 an hour for an agency nurse. So the demand that's been created nationally for agency nurses is a real challenge for everybody in healthcare.
What as you look forward, you look ahead, what are your concerns?
I worry about burnout of our staff. They've been through a lot during COVID, and I think it was a shocker for them to think they're going to have even less people in the institution. So we worry about the long-term sustainability of these types of staffing levels and making sure that we can take care of many of the patients that come into our care.
Tom Quattrochi, the CEO of Erie County Medical Center in Buffalo, New York. Thank you very much.
Thank you very much, John.